Good evening. My name is Jacopo Villani, and I represent a team of 8 mental health service coordinators for travelers. Our project, Traveling Towards Mental Health Equity, aims at improving the mental health outcomes of members of the Irish traveler community through the creation of a more sensitive mental health service. I'm going to show a short video which will introduce the problem that we would like to address.
My name is Sandra McDonough. I am a proud traveller woman and a social worker working within my community. Poor mental health and suicide is having a huge impact on the traveller community, and indeed I have worked with many families where there have been multiple deaths by suicide. We know that at least 11% of all deaths in the traveller community is from suicide, and if this statistic was in any other group there would be an outcry. It is evident from my work that the one size fits all in mental health services is not working. A lot more needs to be done and the system needs to change.
So Sandra has introduced the problem, which is that mental health service provision in Ireland is one size fits all. So the mental health services are shaped to meet the needs of the majority population, and very rarely they take into account the needs of disenfranchised ethnic minorities. And research shows that Irish travelers, who are the largest ethnic minority group in Ireland, not only experience a poorer mental health outcome compared to the general population, but also they are overrepresented in the mental health services, and they have more difficulties to access the services. Research also shows that 82% of travelers are affected by suicide, that 67% of HSE staff agree that travelers experience discrimination in accessing services. So this leads to distrust towards the services. And our own assessment in one area shows that there is a 25% of traveler no-show rates at appointment, which approximately correspond to 3,000 missed appointments annually in the country. So this problem affects travelers who miss the opportunity to avail of services and treat themselves, but also it affects HSE clinical staff, administration, and finance. How is this problem being tackled at the moment? There are traveler groups who deliver traveler cultural awareness trainings at grassroots, but these initiatives differ from county to county, and also they're not resourced to be delivered systematically. And also there are traveler mental health coordinator posts who are working at regional level, but there is a need for a more coordinated national approach in order to achieve more structural, long-lasting impact. So in fact, this problem is not being tackled in a coordinated approach, and we believe there is a need for a more coordinated national approach to this issue. And this is our proposal. We would like to create a world's first traveler inclusion quality framework, which will entail the development of quality standards of working with travelers in collaboration with traveler groups, with the Mental Health Commission, with the mental health services, and also the creation of an accreditation system, which will enable the mental health teams all over Ireland to achieve and adhere to the quality standards, but also to achieve and gain a certification of competency of working with members of the traveling community. And this is our plan. So in the first phase, we will develop the framework, which will be based on 4 pillars of partnership, education, public sector duty, policy development. And in this phase, we will also develop an accreditation body and a step-to-step process of evaluation and accreditation. In the second phase, we will pilot this framework in 2 different areas. We will make an evaluation, and then based on the evaluation, in the third phase, we will upscale the project at national level. We believe there are many benefits in this approach. So there will be improved knowledge and skills of mental health professionals. This will lead to improved quality of care towards travelers, which will increase the community confidence and trust towards the mental health services. And this will lead to a reduction of the traveler no-show rates, which of course will correspond to a significant cost saving for the HSE. And this is how we're going to spend the money. So we will conduct roundtable discussions and consultation. We will conduct a pilot and an evaluation, and we will have a communication strategy. And once this project is off the ground, we will need an additional 30,000 euro to upscale the project at national level. We also believe there will be huge returns on investment. In fact, by reducing the very high traveler no-show rates, we will be able to save approximately 300,000 euro per year. And also we will enable the mental health teams to comply with their duty of care. We will build social capital, and better engagement will lead to better mental health outcomes for members of the traveling community. So we think that together we can challenge perspectives, and through advocacy and support, we can transform our mental health care system so that it provides effective care for all. So let's make equity real. Thank you.